AB 1174, Assembly Member Bonilla.
Thank you very much, Madam Chair and members. AB 1174 makes simple but effective changes to the Bureau of Automotive Repair. I guess this is BAR Day in BMP. In order to improve consumer protection, increase the transparency of auto repair dealers and BAR, and reduce the amount of bad actors in the industry. Existing law authorizes the Director of the Department of Consumer Affairs to adopt and enforce the rules and regulations necessary to carry out the purposes of the Auto Repair Act, including a system for the issuance of citations and fines. AB 1174 clarifies this existing authority to ensure that BAR has the necessary enforcement power to achieve the highest level of consumer protection. In addition, this bill requires BAR to adopt and post to their website regulations regarding the Bureau's policies and procedures for the handling of consumer complaints, investigations, and the methods of resolution. BAR must also track and retain data on every method of resolution attempted and completed, reporting the details of their efforts to the legislature annually beginning January 1st, 2018. AB 1174 was introduced following a February 2016 investigative report by NBC Bay Area, in which an automotive repair dealer committed an egregious act of fraud and neglect in November of 2015. The shop seriously damaged a customer's car while being serviced and tried to cover up the accident. And the owners only admitted only admitted wrongdoing after photos surfaced, proving the damage was done by their employees. Although BAR conducted a full investigation into the complaint and a case has been filed with the Attorney General's office, the shop has continued to operate to this day without any formal discipline, such as a fine or a suspension, and without any public notice of the incident beyond the report from NBC. This measure that before you today addresses this serious concern and will help improve the transparency and communication between consumers, the Bureau, and automotive repair dealers across the state. AB 1174 is the product of many conversations with small business owners, consumers, and the Bureau of Automotive Repair, and currently has no opposition. Thank you very much.
Witnesses in support.
Madam Chairman, Michael Gunning, Personal Insurance Federation. We're here in support. As you may understand, as insurance carriers, one of our biggest expenses is repairing cars. And we think that consumers should know about all their repairs and think that this bill provides transparency, and here in support.
Additional witness support. Go
Madam
ahead.
Chair, Armand Feliciano on behalf of the Association of California Insurance Companies. We're also in support of the bill.
Hi, Jack Molodanoff again on behalf of the California Auto Body Association, the Automotive Service Councils. We were opposed. We've removed our opposition. We want to thank the Assemblywoman for working with us and addressing our concerns, and also thank her staff, Ryan. They did a great job, and we are neutral now. Thank you very much.
Thank you.
Chair and members.
Mike Belote for the California New Car Dealers Association. We never adopted a formal position, but we did have extensive conversations with the author and her staff, and want to thank them. We certainly felt that our issues were considered and taken care of. Thank you.
Witnesses in opposition. Are there any? Don't see any. Committee members, any comments, questions? Dan, would you like to close, Assemblywoman?
Just ask for your aye vote. Thank you.
Do we have a motion? I'll move the bill.
Motion is due pass to Senate Appropriations Committee. Hill. Bates.
Aye.
Bates, aye. Block. Gaines. Galgiani. Galgiani, aye. Hernandez. Jackson. Mendoza. Wachowski.
We have 2 votes. We'll hold the roll open. Absent members. Okay, we want to wait.
Go ahead.
You want to go ahead? Okay. Then we'll do AB 1306, Assemblywoman Burke.
Thank you, Madam Chair and Senators. I want to begin by thanking you for your work on this bill. It's been a long process for all of us, so I do appreciate the hard work. AB 1306 allows certified nurse midwives to manage a range of primary health care services for women within their existing scope of practice. This bill untethers them from physician supervision to continue to provide the same services they've been providing for decades. I think we can all agree that certified nurse midwives should be able to practice to the full extent of their education and training, and that's really what this bill is about. We have nearly 1,200 certified nurse midwives practicing in California, and while most other states allow certified nurse midwives to practice independently, we're one of only 6 states that require physician supervision. It may surprise you to learn that many of the counties that you represent either have a shortage of OBGYNs or simply no practicing OBGYNs at all. Certified nurse midwives can fill the gap in women's health care in your districts and in communities across the state. Unfortunately, instead of talking about improving access to care for California women and the practice of midwifery in hospital, clinics, birth centers, and homes, there are those who are focused on the corporate practice of medicine ban in California. And this bill has become one more pawn in the fight between hospitals and physicians. I appreciate the work that the chair and all of the stakeholders have put into this bill and the debates many of you have related to the corporate practice of medicine and its merit. I also want to point out that CMA has been very reasonable in negotiating regarding education, training, and standards of care. I do truly appreciate that. However, I hope that you will also appreciate the work that certified nurse midwives have put in over the last year to craft language that holds true the essential role of nurse midwives in our healthcare delivery system and the lengths we've gone to in order to address every stakeholder's concerns. I have discussed with the chairs of both Senate and Assembly Health and BMP that we should have a broader discussion over the corporate practice of medicine. However, this bill should not become a hostage in that fight, and nurse midwives should not be pushed aside while political heavyweights battle for the upper hand. You have before you amendments drafted by the committee staff that remove the explicit corporate practice of medicine ban and put in place clear language that prohibits a corporation, including a hospital, from interfering in care decisions and prohibiting retaliation. As a woman, no one understands more the importance of these principles. I believe this language addresses the core principles that defenders of the corporate practice of medicine ban should be able to support. If this language needs to be strengthened to ensure enforcement, I am more than happy to have that discussion. My goal here remains the same as it did when I introduced this bill last February. Certified nurse midwives should be able to independently provide collaborative care that put women first, with all of the appropriate safeguards that consumers expect. With that, I respectfully request your aye vote.
Thank you. Additional witnesses, go ahead in support.
Good afternoon. My name is Linda Walsh. I'm a certified nurse midwife and president of the California Nurse Midwives Association. Certified nurse midwives are educated in graduate accredited programs. Following graduation, they sit for a rigorous national certification exam and must continue to demonstrate competency through a national recertification process. We are licensed by the Board of Registered Nursing to practice midwifery, a profession providing well woman primary care, family planning, as well as the usually understood maternity care. The American Congress of OBGYN has reported that the current OBG workforce is, I quote, strained, as demonstrated by the number of California OBGYNs falling below the national ratio of OBGYNs per women of childbearing age. Furthermore, it is estimated that the California adult female population is expected to increase by almost 25% by 2030. Numerous research studies have documented that CNMs provide high-quality, cost-effective care, and because of this, CNMs have the potential for increasing women's access not just to maternity care, but also preventive and primary care. In a paper published by the FTC in 2014, staff concluded that, quote, mandatory physician supervision is likely to restrict advanced practice registered nurses, including nurse midwives, ability to practice independently, leading to decreased access to healthcare services, higher healthcare costs, reduced quality of care, and less innovation in healthcare. For these reasons, I urge your support, and I vote for AB 1306 as a means to increase access to care throughout the state. Thank you very much.
Additional witness.
Yes. Hi, my name is BJ Snell. I'm a certified nurse midwife and a small business owner with 3 freestanding birth centers where care is managed by certified nurse midwives. The birth centers are nationally accredited and state licensed. In addition, I have hospital privileges in the Memorial Care System for those women that choose a hospital birth or need to be in hospital for their birth based on risk. I work collaboratively with physicians and hospitals, and I'm here to enlist your support for AB 1306. Current midwifery practice is a collaborative model. It has never required direct physical presence of a physician during care unless a nurse midwife consults and requests that presence. Most pregnancies and births are completely normal physiologic events and as such do not require medical management. ACOG recognizes that certified nurse midwives are independent practitioners. The practice of midwifery as defined by the American College of Nurse Midwife is referenced in the bill to provide ongoing reference for CNM practice. The joint statement from ACOG and ACNM not only support independent practice, but recognize the consultation and referral process as foundational to complete care. In addition, there is recognition of the competence of CNMs in the provision of care that is evidence-based and collaborative in the healthcare system. Birth centers are innovations in the delivery of care to healthy childbearing women and families that have been shown to affect normal birth. Healthcare goals identified by the state of California have called for a reduction in the cesarean section rate. Cesarean sections are costly both financially and for long-term health of women. Women receiving care in birth centers have an average cesarean section rate of about 6% versus 32% with traditional hospital care. According to the CDC, there's a savings of $1,163 per birth center birth in California, and based on 2013 birth center data alone, there was a savings of $1.6 million. Medical malpractice insurance is available to CNMs independent of physician supervision at the same level of coverage as physicians. While there are many physicians that would welcome collaborative practices with nurse midwives, they are restricted by their malpractice insurance because of the supervision requirement. This bill will fix that problem. All of the evidence fails to identify that physician supervision changes outcomes of care. In some instances, it has been shown to impede collaboration and/or referral, which can affect outcomes negatively. The midwifery model of care is distinct from the practice of medicine and nursing. Removal of physician supervision language will not change the scope of nurse midwifery practice, but will allow for increased access for women and innovative health systems like freestanding birth centers to develop and thrive, saving the state millions of dollars and improving the health of women in California by lowering cesarean section rates. Thank you for your time.
Additional witnesses in support.
Amber King with the Association of California Healthcare Districts in support.
Good afternoon, Madam Chair and members. Pat Whalen, Ellison Wilson Advocacy here on behalf of UNAC, that's United Nurses Association of California, Union of Healthcare Professionals, a proud member of AFSCME. I want to thank the author for wrestling with this issue and urge your support.
I'm Olga Lebova. I'm a certified nurse midwife and doctor of nursing practice. I practice in El Camino Hospital. I'm the constituent of Senator Jerry Hill. I delivered multiple patients from the co-founders of the major companies of Silicon Valley to new immigrants and women on medical. And I urge you to increase the women's access to care by approving this bill. Thank you.
Hi, Kavita Noble from the San Jose area. I'm a certified nurse midwife. I work in the home and the hospital setting, and I urge strong support of AB 1306. Thank you.
Hi, my name is Gina Ariel. I'm a certified nurse midwife, and I've been practicing as a nurse midwife in Yolo County for 20 years collaboratively, and I strongly urge your support on this bill.
Thank you. Timmy Pereira from Santa Cruz, California, practicing at Sutter Hospital. I urge your support. Thank you.
Karen Karp from California Association of Nurse Anesthetists. I'm a certified registered nurse anesthetist and work very closely with certified nurse midwives. We urge strong support, especially with amendments that remove corporate practice of medicine. Thank you.
Hi, my name is Hannah Bronsky-Pena. I'm a certified nurse midwife, a recent graduate, and this is Theo Pena, a consumer of midwifery services. And we urge your support.
Kim Doe, Chair of the Health Policy Committee for the California Nurse Midwives Association, also a certified nurse midwife practicing in San Francisco, and urge your support. Thank you.
Connie Delgado with the California Hospital Association. I want to thank all the stakeholders involved. We are removing our opposition, and once the bill gets in print, we would be recommending support, and we ask for your aye vote today.
Christy Weiss on behalf of the California Association for Nurse Practitioners. Also want to thank the author for taking those amendments today, and we are removing our opposition. Thank you.
Mandy Lee on behalf of Sutter Health. I just want to echo our thanks to the author as well. We are also removing our opposition. Thank you.
Hello, my name's Corey Hollis, certified massage therapist, Oakland resident. I heard the argument today, and I support.
Magna Carta. I am Felicity Helms, also the third Elizabethan by birthright. I'm Queen Elizabeth's granddaughter. I have more children than any other mother in the world. I'm the mother star, and I am in strong support of your bill. Thank you.
Any additional witnesses in support? Go ahead, come forward.
Support is still always.
Hi, Shannon Smith Crowley, representing the American Congress of Obstetricians and Gynecologists, and I feel like even if I didn't have a statement, our name's getting bandied about enough. You might like to see the ACOG representative. Just really briefly, we believe physician supervision should be removed. We believed it so strongly. We actually sponsored AB 1308 in 2013 to remove physician supervision from licensed midwives. It was extremely problematic how that was working because, again, as BJ said, that especially for home births, physicians couldn't supervise, collaborate, back up, anything having to do with licensed midwives, and it was causing a lot of problems, so we removed the supervision and we sponsored that bill. That being said, on this bill, we did not come in on a support unless amended position until the corporate bar issues were worked out. So we're a little concerned about where that is now, and we've got some concerns in terms of the current interference with insurance companies and hospitals, and especially Catholic hospitals, on the reproductive health care practices. One of our issues with hospitals employing certified nurse midwives directly is one of the beauties and why they work so well, the certified nurse midwives, is the time they spend with the patients. If the hospitals start interfering with that, not unlike how they were imposing a lot of patients with the registered nurses, where it was so severe 15 years ago, the legislature had to put in a nurse staffing ratio. Then a lot of the benefits of the certified nurse midwives is diminished. We also had some other amendments. Some amendments were taken, and we appreciate that in terms of talking about what kind of patient the certified nurse midwife can have. There were 3 other sections that we asked where there are consumer protections on the licensed midwife side for home birth that we would still like to see in this bill. So.
Thank you. Witnesses in opposition?
Good afternoon, Madam Chairwoman and members of the committee. My name is Juan Thomas. I represent the California Medical Association. We were on a neutral position on the bill. First, let me back up, and I want to thank Assemblywoman Burke for her work on the bill. We did have good stakeholder meetings that were focused on not just on the clinical aspects, but also what CMA considers as to be important consumer protection measures. And we appreciate all the work that she did and the sponsors of the bill too. We actually believe that CMA has come a long way on this issue. Historically, CMA has opposed removing physician supervision. This year, for both advanced practice registered nurses bills, AB 1306 for CNMs and SB 323 for nurse practitioners, we agreed to remove supervision. All the literature, I think, and even in the informational hearing, everyone agrees that supervision is a legal mechanism by which advanced practice nurses are able to perform medical procedures or provide medical services. If you're going to remove that legal mechanism and continue to let advanced practice nurses provide medical services and perform medical procedures. We think everyone who is doing that, physicians, advanced practice registered nurses, should play by the same rules. Those rules include the corporate practice of medicine. The advanced practice at CNMs will have full prescribing. They will be diagnosing and doing treatment plans, and even in this case, cutting. That's all the practice of medicine. And we think that it's reasonable and fair to say that everyone who's providing medical procedures and medical services should play by the same rules and provide the same level of consumer protections. Also, it's a little disconcerting because we thought we had a good product here. We had worked out an agreement, and it sort of saddens me to be put in a position to now oppose the bill. I also would like to, point out something that I found interesting, that in the analysis on page 9, it quotes that there are only 5 states that have the corporate practice of medicine. It quotes a 2007 report. But in the report commissioned by this committee on the corporate practice of medicine, it said that more than half of the states clearly prohibit the corporate practice of medicine. So, wondering why the latest report isn't in the analysis, and the earlier report that was corrected is not, and the later report's not in the analysis.
Jody Hicks, representing the California Academy of Family Physicians, and want to echo my colleague both in thanking Assemblywoman Burke for the hours we spent in those meetings, and they were productive, and disappointed that I'm also here in opposition today. And the only thing I will add for the family physicians is the issue of corporate bar. We would be here if we were talking about any of the other protections that are for physicians as well. And their kickback laws, anti-referral, even MICRA, things like that, that we just believe, all in all, and we were in the same position with CMA, that if we're going to remove supervision, which we believe is appropriate in certain circumstances and for this bill, that patients expect whatever patient protections the legislature has put in place apply across the board. And the issue of corporate bar is contentious, obviously, for the stakeholders that have opposed or supported this bill based on that issue. But the fact is, it's been heard by the legislature several times. There's been an informational hearing. And as of today, the legislature has upheld that we should have a ban on the corporate practice of medicine. So whether you agree with that or not today, the legislature has made that decision, and it should apply to anyone that's practicing for patients. That patient protection should continue. If we decide later that we don't need the ban any longer, and it should apply to everyone there as well. So unfortunately, we are in opposition today. Thank you.
Comments, questions from, I don't see any additional opposition. Then back to the committee. Would you like Senator Hernandez?
Yeah, I have a couple comments. First of all, Senator Burke, number one, I applaud you for looking at access, but more in particular, access to all communities that need it the most. I respect the profession that you're representing, and I also appreciate the fact that you did remove the corporate ban. I'll just make some comments in general about it. In California, whether we discuss and argue whether it's 3, 5 states throughout the country, but I think in California, if we look at it kind of in its entirety, it's not consistent. And this is my concern when we talk about it, because entities that are not subject to it would be, for example, entities that are licensed under Department of Managed Healthcare through the Knox-Keene Act, through an HMO. You have federally qualified health centers. You've got teaching institutions. Now, a lot of entities are doing foundation models to get around it. I know that Assemblymember Wood did something with a hospital in his area, so there's kind of a carve out there. So it's inconsistent, you know. So I think that I agree with the concept about corporate ban when it was first put into place, because back then healthcare as a whole looked totally different than what it looks like today. And the purpose of it was to protect the consumer or the patient from undue influence. So, but I also feel comfortable with what I believe you have in your bill. It has language in there that does that. It addresses that no one, I believe, the support unless amended, unless I read the language incorrectly, and we may want to verify it, says that you can't unduly influence the decisions by that practicing provider. So I think you're addressing the fact that the patient is going to be protected. I don't know about the other protections, whether it's, capping and steering, referrals, that's a whole different conversation. But I believe it's appropriate in this conversation where you're at, so yeah.
Go ahead.
Thank you.
You want to respond, certainly.
So I do want to address, those are in the bill already, but what I also would like to address is that, yes, we did take language that hopefully does protect the consumer. I do understand CMA's concern that there needs to be insured enforcement, and obviously that we will address that immediately. I also want to point out in this particular situation, I do understand that there should be parity for everybody as far as the CPM is concerned. Clearly, that is an issue that we have had long hours of discussion over the last 2 weeks with the chairs of both BMP and Health on Senate and Assembly side, that it is time for us to create what that looks like. However, I do want to point out in this particular case that we are referring to 15 to 20, maybe at max, certified nurse midwives that are employed by a hospital. So the rest of the bill that we have worked out with everybody that did have agreement, or at least no opposition anymore, or less opposition than there is now, we did work out those issues. And so now what we are referring to now is 15 to 20 certified nurse midwives that are currently employed by a hospital. That's, when we talk about CPM, we're talking about those 15 to 20 people. I also want to point out that I do understand on some level the importance of CPM. As a woman, I do not want to be concerned with the concept that a religious institution comes into a hospital and then by any means necessary, my reproductive rights have somehow now been challenged. So I do understand the need for it on some level, but I think in this particular case, when we're referring to 15 to 20 certified nurse midwives, that for this bill and this kind of access, for like I said, for those on this panel, I think we have some people who have one OBGYN for every 10,000 women. Some have not even that on this panel. I do think it's incredibly important to look past that right now, and we will continue, like I said, to work on the enforcement. But now, I respectfully request an aye vote.
And I will consider that your close, Assemblywoman. I'm sorry. Senator Block, yes.
Thank you, Madam Chair. I just want to thank the author. She came to my office last week. We had a good discussion about the bill, and I expressed my concerns about the corporate bar issue, and the amendments that you've taken resolve my concerns and allow me to vote in favor of a bill that will really help nurse midwives and help women throughout California. So thank you for that. And we'll take that as a motion.
Then you are accepting the proposed amendments with the motion, correct?
Yes.
Yes, good. We have not had an opportunity with our Senate analysis on the Republican side to really look at your amendments. They came in 10:23 a.m. this morning, so I will be laying off, but I do appreciate all the work you have done, and certainly with the certified nurse practitioner midwives. They've been working on it, I know, since last year, and my issues really had more to do with the prescription and whether there was clinical, studies that went along, and I think they've convinced me that they're there in terms of what they can prescribe. So most likely we'll support, but I think it's only right that we have an opportunity to get a full analysis. So with that, we do have a motion, and we'll ask the Secretary to call a roll.
Motion is due pass as amended to Senate Appropriations Committee. Hill, Bates, Block.
Aye.
Block aye. Gaines, Galgiani, Hernandez.
Aye.
Hernandez aye. Jackson, Mendoza, Wachowski.
Aye.
Wachowski aye.
That has 3 votes, so we'll hold the roll open for the absent members.